Hi, I'm Dr Alex Perry from the Blue Sky Clinic. Welcome to another webisode on our website. In this webisode I want to talk a little bit about what's involved in treatment, and that's one of the very common questions that we get asked prior to treatment is what's actually involved and how does it work and how long does it take. Sometimes it can be very hard to put a time frame on things, but we always give a rough idea of the sort of time frame that we would expect a condition to resolve in, or to at least improve to the degree that we would like it to improve. But really the first step in any treatment is to make an appointment, obviously, and in that consultation, that initial consultation, it's probably the most important part of your treatment. And typically in an initial consultation we'll spend about 1 hour and we'll take as much medical and personal history that is important to try and determine what your condition is about, why it's there, and how we're going to deal with it. So gathering that information is the most critical step. So the first thing we do really is to ask some questions and to listen. And that listening is really, really important, because that gives us an idea, it gives us all the information we need in order to start to form an opinion as to your health. And really, whenever we talk about a condition or your condition, we talk about 3 phases. The first phase I describe as where have you come from, and really that's talking about what we would describe as etiology, and etiology just means the mechanism or the pathway or the progress of your condition from beginning to where you are now. So really that's first step is about finding out how you've got to this point, and that's really important in terms of deciding, not only how to treat you, but where did this condition come from in the first place. The second aspect of listening and the second phase is to work out where you are right now. And where you are right now really is our differential diagnosis. So you may or may not be aware of this word differential diagnosis. You've all heard of diagnosis. And diagnosis really is just saying, well, this is what you've got right now. Differential means to differentiate it from other diagnoses. So if we gather enough information, if we gather correct information, then we should be able to differentiate your condition from other conditions that are similar and come up with a correct diagnosis. But that listening and that first consultation and gathering that information is absolutely critical in getting this right. The reason for that is if we get this wrong, then everything else downstream of that is going to be wrong in terms of treatment. So getting a differential is really, really important. So we've got phase 1, which is where have you come from. Phase 2 is where are you now. And phase 3 is where are you going, where would you like to go. And what I like to do is set some health goals. What are the things you'd like to try and achieve. Now if it's fertility, it's pretty easy to say, well, we'd like to have a child. But we can break that down into smaller goals in terms of what sort of a period we would like you to have. How we'd like to get you to ovulate regularly. Those sorts of things. Or if it's a simple pain, I say simple in inverted commas, pain condition or musculoskeletal injury, then we might talk about, well, getting you back on the field or getting you back up and running or back at work, or whatever the case may be. So having some goals is really, really important. So that third phase is very much about working out where you're going to go. And the way that I would describe that is to develop a treatment plan. And a treatment plan is that third phase. Where are you going? Why you want to go there? And really importantly, how we're going to do it. So we talk about the how. And the how really has to do with what way are we going to treat you? What aspects of the Chinese medicine kit bag are we going to use? And typically, for most conditions, not true of all, but most conditions, we would use a combination of acupuncture and herbal medicine. Sometimes it's just acupuncture, sometimes it's just herbal medicine, but often it's a combination of the two. And there are other aspects that go with that. Cupping therapy, tuina, which is massage, moxa, which is heat therapy. We can use heat lamps, patches, liniments, a whole range of different sorts of medications can be used. But that treatment plan process, and particularly talking about the how, is really important, so that when you finish that initial consultation, that first consultation, you should have a really clear idea about what we're trying to achieve, how we're going to try and achieve that, how we're going to measure it, and a time frame that we're going to do that in. So at the end of the consultation at the Blue Sky Clinic, you'll be really, really confident in what we're trying to do. And if you're not feeling confident about it, then we encourage you to ask more questions so you understand exactly what we're going to do. And I believe that it's important, in fact I believe that it's vital that you as a patient are empowered by understanding where we're coming from so that you can be a key player in our treatment. I always think about treatment with you as a patient, myself as the practitioner. You're the captain of the team and I'm your support staff. So I'm here to help you get well or get better or to meet your health goals. But really it's a team approach. So I hope that makes sense. So that first consultation, and the way that we like to say, and I put it there, is to listen, and then we take some time to explain what and why, and then the third part is resolve. We try as best we can to resolve any issues that you have from a health perspective. So listen, explain and resolve. So really the treatment process starts most importantly with that first consultation. And that'll usually take about an hour. Sometimes it takes a little longer, sometimes it takes a little less. It really depends on the individual condition, but we always plan for about an hour's worth. And that'll include treatment as well. So usually in a first consultation, once we've done all of this, then we jump straight into treatment, usually involving acupuncture, herbal medicine, that sort of thing. So I hope that makes sense. In terms of the first consultation, a follow-up consultation is usually a much shorter affair, usually somewhere between half an hour and 40 minutes, depending on what you're coming in for. And what we normally do in a follow-up consultation is spend 5 to 10 minutes just seeing how you've gone in the previous week, how you've gone with your medication, if there has been any, how you've gone with your treatment, and then we treat at that point with acupuncture and so on. And that tends to carry on. Now, it's important to say acupuncture is rarely a one-off treatment. Acupuncture tends to be accumulative, so that you have a number of sessions. They tend to have a greater effect reasonably close together than they do a long way apart for most conditions. So usually a treatment plan or a treatment time frame will last about the 6-week mark, depending on what the condition is. But after 6 weeks, one of three things will happen. You'll get resolution of the condition, which requires no further treatment, and that does happen for a range of conditions. The second option is that you get significant improvement but may need some form of maintenance or ongoing support. And longer term conditions, chronic conditions, fertility, gynecology, those sorts of things tend to take a little longer. And the third option that's always important to mention is that we may not get the result that we're looking for at all. So we need to think about, are we on the right track? Do we need to do something else, or not do it at all, or refer you to someone else? But probably 90% of our patients will fall into that second category. Great results, big improvement, meeting many health goals, but may need some form of ongoing maintenance. So I hope that makes sense when we talk about what's involved in a consultation and how long it's likely to take. It's very hard to say, yes, exactly how long it's going to take. We always aim for that 6-week mark as a starting point. Some things resolve quicker, some things take longer, but they'll give you a bit of an idea of what we're looking for, how we go about doing it, and that way when you come in for a consultation you'll be, you know pretty much what to expect. So anyway, I look forward to seeing you on the next webisode. If you've got any questions, please email me at reception@blueskyclinic.com.au, or you can call me. All the details are on the website. Either way, I look forward to speaking with you soon.